Post-traumatic stress disorder, PTSD, is a mental health condition that develops after someone experiences or witnesses a traumatic event. The symptoms can deeply affect your emotional, physical, and psychological well-being, sometimes making it difficult to function in daily life. Often, people with PTSD don't recognize the signs or connect them to past trauma. Understanding the symptoms is the first step toward seeking help and healing. Here are 12 key signs you might be suffering from PTSD. 1. Intrusive thoughts or flashbacks. One of the hallmark signs of PTSD is experiencing intrusive, distressing memories or flashbacks of the traumatic event. These can come without warning, triggered by something as simple as a sound, smell, or sight that reminds you of the trauma. Flashbacks often feel incredibly real, as if you're reliving the event all over again, complete with the same emotions and physical sensations you felt at the time. 2. Nightmares and disturbed sleep. Many people with PTSD have frequent nightmares related to the trauma. These nightmares may be direct replays of the event or take on symbolic forms that evoke feelings of fear, helplessness, or panic. Over time, these recurring dreams can lead to insomnia or an intense fear of falling asleep, resulting in chronic fatigue and difficulty functioning during the day. 3. Avoidance behavior. PTSD often leads to avoiding anything that reminds you of the trauma. This could mean steering clear of certain places, people, or activities that bring back painful memories. For example, someone who experienced a car accident might avoid driving or even riding in vehicles altogether. Avoidance extends to suppressing thoughts and feelings about the trauma, which can isolate you emotionally. 4. Emotional numbness or detachment. A common symptom of PTSD is feeling emotionally numb or disconnected from others. This detachment can make it hard to form close relationships or enjoy activities you once loved. It often stems from an attempt to protect yourself from emotional pain, but it can leave you feeling isolated, lonely, and misunderstood. 5. Hypervigilance and being easily startled. Hypervigilance is a state of being constantly on edge, as if you're anticipating danger at any moment. People with PTSD may have an exaggerated startle response to sudden noises or movements. This symptom can manifest as a constant sense of unease, irritability, or trouble concentrating, as your mind is always on high alert. 6. Mood swings and irritability. Trauma affects how you regulate emotions. You may find yourself snapping at loved ones, experiencing intense anger over minor inconveniences, or feeling sadness that seems to come out of nowhere. These mood swings are often tied to the lingering effects of trauma and can strain relationships or lead to feelings of guilt and shame. 7. Difficulty concentrating or remembering details. PTSD can impair cognitive functions, including memory and concentration. You may struggle to focus on tasks, forget important details, or feel mentally foggy. These difficulties often stem from the brain's response to trauma, where survival instincts override normal thought processes. 8. Feelings of guilt or shame. Survivor's guilt is a common symptom of PTSD, especially for those who have lived through disasters, accidents, or violence. You might blame yourself for the event or feel ashamed for not being able to prevent it, even if it was entirely out of your control. This guilt can be a significant barrier to healing and may worsen other symptoms like depression or anxiety. 9. Loss of interest in life. Many people with PTSD experience an overall loss of interest in life. Activities that once brought joy may now feel pointless or burdensome. This apathy is often linked to feelings of hopelessness or a belief that life will never return to how it was before the trauma. 10. Physical symptoms and chronic pain. Trauma doesn't just affect your mind. It can also manifest in your body. People with PTSD often experience headaches, stomach issues, muscle tension, or chronic pain. These physical symptoms are thought to result from the body's prolonged, fight or flight, response to the trauma. 11. Difficulty trusting others. Trauma, particularly interpersonal trauma like abuse or betrayal, can make it hard to trust others. You might find yourself constantly questioning people's intentions or feeling suspicious, even when there's no real threat. This lack of trust can create barriers to forming and maintaining healthy relationships. 12. Self-destructive behaviors. PTSD can lead to behaviors that harm your well-being, such as substance abuse, reckless driving, or self-harm. These behaviors often serve as coping mechanisms to numb the emotional pain or distract from traumatic memories, but they can exacerbate the condition and create additional challenges. What causes PTSD? PTSD can develop after exposure to various types of trauma, including combat or military service, physical or sexual assault, natural disasters, e.g., hurricanes, earthquakes, serious accidents, e.g., car crashes, workplace injuries, prolonged exposure to stress, e.g., childhood abuse, domestic violence. Not everyone exposed to trauma develops PTSD, as factors like resilience, support systems, and individual coping mechanisms play a role. How PTSD differs from other stress reactions. It's normal to feel stressed or anxious after a traumatic event. However, PTSD symptoms persist for months or years and significantly interfere with daily life. If you notice that these signs are affecting your relationships, work, or overall well-being, it may be time to seek professional help. When to seek help. Recognizing the signs of PTSD is crucial, but understanding when to seek help is equally important. You should consider reaching out to a mental health professional if symptoms last longer than a month. They interfere with your ability to work, maintain relationships, or enjoy life. You experience thoughts of self-harm or suicide. Treatment options for PTSD. Thankfully, PTSD is treatable. Common approaches include 1. Therapy. Cognitive behavioral therapy, CBT, helps reframe negative thought patterns and reduce fear responses. Exposure therapy gradually confronts traumatic memories in a safe environment. Eye movement desensitization and reprocessing, EMDR, targets distressing memories to reduce their emotional intensity. 2. Medication. Antidepressants or anti-anxiety medications can help alleviate some symptoms. 3. Self-care and support. Engaging in mindfulness, physical exercise, or creative outlets can help manage symptoms. Building a support network of friends, family, or PTSD support groups can be invaluable. Final thoughts. PTSD can feel overwhelming, but recognizing the signs and understanding the condition is the first step toward recovery. If you or someone you know is experiencing these symptoms, remember that help is available. Therapy, medication, and support can make a significant difference, helping you regain control and find hope for the future.